So let's talk about our patients. Who are they? How do we find patients in need of our services? Many people don't even know what wound care is and assume that all doctors can take care of any wound. Let's take a look at some stats. We know chronic wounds are mostly seen in the elderly population. And as the elderly population increases, chronic wounds will continue to be an increasingly persistent problem. Overall, in the United States, 2% of the total population are estimated to be affected by chronic wounds. Now, the fact that wounds are not viewed as a disease entity presents a major challenge that we face in the current health system. The most common comorbidities associated with chronic wounds, they are, first one being diabetes. The risk of development of these ulcers, as I said, is incredibly high, estimated to be anywhere from 15 to 25%. And 14% to 24% suffer from amputation.